Welcome, one and all.
Yes.
My name is Dr. Kishore Kumar. I am heading the Department of Integrative Medicine at NIMHANS, Bangalore. Integrative Medicine Department NIMHANS offers clinical services, training, and research in Ayurveda, yoga, and modern biomedicine, specifically in the area of mental health and neurosciences. Today, we are all here for a webinar. And this webinar is part of a month-long series which intends to raise awareness of evidence-based insights into Ayurveda, yoga, and modern biomedicine, especially in the treatment of mental health and neurosciences. To give a very brief history of the department, NIMHANS has been in the forefront of healthcare in mental health and neurosciences since decades by visionary leaders, including the current director of NIMHANS, Dr. D. Nagaraja and Dr. B. N. Gangadhar, who are also former directors of NIMHANS. The Department of Integrative Medicine started functioning in NIMHANS in 2019. The philosophy of the department is to give optimized care in mental health and neurosciences, bringing in the best of all systems of medicine like Ayurveda, yoga, and also modern biomedicine by filling the treatment gaps in mental health and neurosciences. We have we run OPD. We have a 30-bedded inpatient facility. We offer courses like MD Manasaroga, MSc Yoga, postdoctoral fellowship in integrative mental health and neurosciences, postdoctoral fellowship in integrative psychiatry, PhD in integrative medicine. Apart from that, we also conduct state-of-the-art research in which basically looks at finding out or bringing out evidence base for the actions of Ayurveda, yoga, and modern biomedicine in the treatment of mental health and neurosciences. In collaboration with the Ministry of Ayush, Government of India, we have launched a month-long awareness program and we have named it Ayush Month. This program intends to reach out to the public and professionals and the scientific community, student community, as much as possible, and then bring awareness of the importance of integrative medicine, yogic and Ayurveda principles in lifestyle and also in the healing process. So as a part of this program, we are conducting series of webinars and guest lectures, and this is the first among such series. So on behalf of the director NIMHANS, Registrar NIMHANS, I extend a very warm welcome to all those who have assembled, who have logged in into this webinar. Today we have with us stalwarts in the field of Ayurveda and Yoga. First among them, I would like to welcome Dr. B. N. Gangadhar, who is Professor Emeritus of the Department of Integrative Medicine at NIMHANS. He was a former director of NIMHANS and also former chairperson of the National Medical Commission, New Delhi. Welcome you to this webinar, sir. It also gives me pleasure to welcome Dr. Raghavendra Rao, who is the director of Central Council for Research in Yoga and Naturopathy, Ministry of Ayush, Government of India, who, in spite of busy schedule, offered his participation in the webinar. Thank you very much for joining, sir. I extend a very warm welcome on behalf of the director NIMHANS and all who have logged in into the webinar. We also welcome Dr. Lakshmi Kandan. Dr. Lakshmi is a faculty in Morarji Desai National Institute of Yoga. He has a wide experience in yoga and stress. He consented to join in this discussion. Thank you very much for joining. I welcome Dr. Lakshmi Kandan. Welcome, sir. I also welcome Dr. Madhav Digavi, a stalwart in the field of Ayurveda and Kaya Chikitsa, and also Manasuruga. He is currently serving as professor in the Department of Kaya Chikitsa at Government Ayurveda Medical College, Bangalore. Welcome you to this seminar, sir. We are very honored to have you.
Thank you, sir.
Along with that, we have the faculty of the Department of Integrative Medicine, Dr. Hemant Bhargav, who will be moderating the annual discussion. I welcome you to this webinar.
Thank you,
Bhargav. I also welcome Dr. Bharat Holla, who's the who's the faculty who's the secretary faculty of the department. Dr. Umesh, who's the assistant professor of Ayurveda in the department, and he's also going to present insights from Ayurveda in stress and anxiety. And we also have the other staff, faculty, residents, and students. Apart from that, we have many people who have joined this webinar from outside the MHANS, belonging to various educational institutions and also healthcare sector. So I once again welcome all of you to this webinar on throwing light on evidence-based insights from yoga and Ayurveda in mental health. Uh, Let us begin the program. So I hand over the mic to Dr. Didi.
Good afternoon, one and all. We will begin the session by inviting our beloved Professor Emeritus, Dr. B.N. Namara, to give a welcome and introductory address. Sir, can you please unmute yourself, sir?
Thank you. Thank you very much for inviting me on this webinar related to Ayush Man event that is happening at NIMHANS. NIMHANS has several unique features and several firsts in its contributions. Among them is the setting up of the integrative medicine department, which is not merely a co-localization of two different specialities or three different specialities, but a integrated, collaborative, clinical, academic, and of course, research department, which has been working in the progress of integration of Ayurveda and yoga into modern science, mental health, and neurosciences in particular. In addition to, of course, conducting research, conducting different courses, as Dr. Kishore, head of the department, mentioned. And this event makes an important milestone in our reaching out to people and also making the integrative medicine known to the public as well. So I welcome each one of you to this event, those who have joined physically in the meeting there in our boardroom, and also for those who have joined online using technology. Wish you all the best. Over to the organizers.
Thank you very much, sir, for your always encouraging and inspiring words. We will begin the directed session. I invite our Professor of Ayurveda, Dr. Umesh, to give us insights on the topic of Ayurveda for anxiety and stress management. So I'm making the co-host, so you can share your slides.
it's not allowing to share this slide, Aditi. I think.
So please try again, sir.
Yeah, yeah. Now, namaste to everyone, and I thank the organizers for this opportunity. So today I would like to share a relevant topic on Ayurveda management for stress and anxiety. So I welcome you all for this thing. And if you see, I think stress and anxiety, these are the two words nowadays we are being able to see or hear universally. And these two are the two words that we have been able to appreciate almost every day, irrespective of the area, whether it could be work, home, or nowadays, even we have been able to see these two words in children's. And exactly what this stress is. If you go to understand what stress is, it's the body's reaction to some challenge or a pressure, like, and at that point of time we can see that whenever there is a problem, or whenever there is a challenge or a pressure, whenever there is a deadline that is being set in, so basically our heartbeats feel faster and we feel tense and we cannot relax. So this is what exactly the stress is, and majority of the time it would be an external trigger. Especially if you see example what it is, it's like a student has to face an exam tomorrow, or an adult on a worker who is working in an office, he has a deadline. So when such things are there, so these are the challenges or the pressure because of which makes the patient to feel that stress. So when we see some amount of this stretch is really fine, like for example, some amount of stress is good, it helps to prepare as well. Why? Because we'll be well prepared and other things. But if this stress continues for a long time, and if we are not able to cope up, so then it becomes harmful, and that is the time somewhere we need to find some methods to counteract this stress. So if you try to understand like what exactly this stress and how we perceive and how it affects our health, we know that each and every individual is different. So, accordingly, we respond to the environmental stressors, to the major life events, and trauma and other things. So, once this is perceived as a stress in our mind, so then it evokes a behavioral response and a physiological response. And these two can be managed in the body. So, there is a certain stress levels where in the body can tolerate it and it can respond to it. So this is our resilience power. But once it is more, where it crosses that barrier of our stress threshold, which we call it as an allostasis or allostatic load, which is more, so then the person is no more able to like handle it, and the stress try to affects us in various ways. Like for example, it affects as headache, heart palpitation, increased blood pressure, digestive upset, muscle tension, fatigue, dry mouth, and insomnia. That is, there is loss of sleep. So this is how the stress tries to affects the body. And similarly, when we try to understand the anxiety, so like as stress is something like an excess of it's the threshold where we have been not able to take it further. So anxiety is also a sort of like stress and anxiety go both hand in hand. So one triggers the other. So anxiety is also a sort of excess worry. Like for example, if you take, there is an exam or a deadline, but still we have some time, and the thought starts to flow in our mind that what happens if I fail in the exam, what happens if I'm not able to meet the deadline. So this is the sort of the worry that is being there in the mind. So generally these sort of worries will be there, some amount of worry will be there as a part of our physiology, wherein the person feels to be a little restless, sleep will be disturbed, and the mind will be repeatedly thinking about that work or the target that is being there. But when it becomes so persist that it starts to affect our daily routine, like for example our performance, our schoolwork, our relationship. So when it starts to interfere in our each and every activities of day to day life, then it is something we need to think about it, and we need to take certain measures which we need to effectively handle this anxiety. And when we talk about anxiety, the certain symptoms that are manifested are feeling nervousness, especially the palpitation will be there, tremors will be there, sweating, the heartbeat will be raising, the person feels very restless, and there will be some gastrointestinal symptoms in terms of frequency, increased frequency of urination, diarrhea, and other things. So this is an overarching, like what exactly the stress means, what is anxiety, and what is the normal amount of stress, and what happens if the stress becomes excess, and what is the normal anxiety, and what is abnormal when it starts to interfere in the day-to-day routine activities of our life. So next, we'll try to understand why this a person is susceptible for these stress and anxiety. So basically, the causes can be broadly classified into three, as some biological causes, some psychological, and social and lifestyle things. Especially, there could be in biological causes, there could be some genetics, wherein a close family member might have been suffering from anxiety and other things. Some changes in the brain chemistry, where the hormones which regulate our mood, when they are low, this makes the person susceptible for stress and anxiety. And high cortisol level, we know that whenever the cortisol level is high, the stress responses will be more in the body. And also some physiological illness like thyroid and chronic pain also make predispose the person to for stress and anxiety. And similarly, psychological factors like personality, this is very much important, and this is what commonly we try to encounter, wherein people will be very perfect or with low confidence. Few will be having always thinking that something worse could happen, so that negative frame of mind, or some adverse events that the person would have undergone previously in terms of post trauma or the difficult childhood. So this is also something which makes vulnerable a person to tolerate, make like wherein he is not able to tolerate the stress or predisposes for anxiety. So similarly, when we are not able to effectively cope up with our daily routines and environment, so this also increases the stress, like in the workplace, school pressure, relationship, poor sleep, junk food, and these are the certain things when we come to that of the lifestyle. So this is very much important. We don't try to like regularize our sleep wake cycle. The food is not balanced, so and excessive screens. So this fast and disconnected modern lifestyle is also that what it makes the person vulnerable for this stress and anxiety. So here, when we talk about Ayurveda, this is the major area, especially regarding that of the sleep, the food, and the lifestyle factors, which we need to more stress upon it, where we have been able to effectively handle the stress. So when we come to that of the Ayurveda understanding of the stress, how the Indian systems of medicine understand the stress. So we know that Ayurveda explains both body and mind are interconnected. So like we don't, Ayurveda doesn't see these two as separate. Why? Because when we treat any condition, so the when we treat a disease pertaining to the mind, we take the body things into consideration, and also when we treat the body elements, we take the mind into consideration. So that is the level of importance that has been given for both body and mind in Ayurveda. And as we know that Vata, Pitta, and Kapha are the three major the bioforces which are there in the body, which govern the functions of the body and mind. And among them, if you see, Vata is the main controller of mind. So Charaka states that Niyanta Pranete Cha Mana. So that is, it is the one which chiefly controls the mind. And when we talk about stress and anxiety, this is something like a component of Vata. So when we are no more able to exercise a control over the mind, or when we don't have a good resilience in order to like counteract this situation, so it's a factor of Vata which makes the imbalance in the vata dosha, which makes the stress and anxiety to manifest in the body. It just like as a wind creates a storm. Similarly, a disturbed vata makes a person restless, worry, and it makes like it creates the fear in the mind. And we know that pitta is always a factor which triggers the things. So once this pitta get associated with vata, then also it leads the heightened emotions can be seen wherein anger and irritation sets in. So in broad sense, if you take this stress and anxiety can be understood under the purview of the disturbance in the vata functions. So wherein the anxiety is taken to be as the terminology that is been that we can equate from Ayurveda point of view is the chittodvega, where chitta stands for mind, udvega stands for the anxious state. So here chittodvega is nothing but the anxious state of mind, wherein the anxiety is explained, and also when there is a raw resilience which is seen in the heightened vata status, that explains the stress. So similarly, as we see what are the factors that are explained in modern science, so these are also certain vulnerability things that have been explained in Ayurveda, especially the physical constitution. We know that each every human being can be categorized into different phenotypes like vata, pitta, kapha, or the combination of all the three. So especially if you see the person with vata and pitta phenotype are more prone for these kind of a thing. So there is a factor in the mind called as driti, which controls the mind. So and these vata and pitta phenotype person have less resilience and less tolerance to the stress. So this makes them more prone for the stress and anxiety. So similarly, there is a psychological trait that has been explained, which is dominated by Rajas and Tamas, where these persons are also very much in prone for the development of stress and anxiety. So the next is the main thing we call it as Alpasattva. So this Alpasattva is a part of, again, the part of the phenotype of Vata, especially wherein they tell us that Alpadruti or Alpa Klesha, where he is not able to like these persons are not able to tolerate the stress, and they have a weak resilience or the mind controlling capacity, and because of which they are not able to regulate their emotions. So especially Ayurveda calls it as dharaniya vegas, where these are the manasika vegas or the emotions, mental emotions which need to be controlled. So such persons which this background of the phenotype dominated by vata or rajas, which makes them very alpasattva, and they are not able to regulate their mental emotions in a better way. So because of this, their diet and lifestyle get disturbed, and this leads to the disturbance in the homeostasis of vata and pitta, and again, and it gives rise to the symptoms in the body. So which can be seen as symptoms of stress and anxiety, and this also affects the resilience of mind and the pattern of thinking, like what we have seen in anxiety, that is always the thought will be preoccupied and will be just thinking on the same thing, which makes the person anxiety prone. And when it comes to that of the management plan, so as we know that Ayurveda is the holistic thing. So in Ayurveda, the stress and its related, especially anxiety, is treated by restoring the balance of Tridosha. And it is just not a cure. So it mainly highlights the prevention and balance of these Tridosha, and also it encourages the Sattva dominance for pleasant and stable mind. So that is very much important. So when we take completely the management, the management can be classified into as three pillars as ahara, that is a lifestyle, vihara, that is the life, ahara is the diet, vihara is the lifestyle, and lastly it comes that of the aushadhi or the medicines, where we try to use the herbs. And when it comes to that of ahara, Charaka clearly defines as that ahara sambhavastu rogascha ahara sambhavaha ita ahita visheshaschu vishesha sukha dukkha yoho. This is apt for today's. Why? Because body is the epitome of food. So what we eat is what that reflects in us. So if we eat good, so good, that is sukha, is that is the health is imparted. So there will be a good resilience in the mind, and there will be a good strength in the body. But if we take ahita, so that which is not conducive to the body, then it leads to a tough the dukkha, which is nothing but the disease status where we will be in not a better position in to counteract the stress responses. The same thing has been also highlighted in Bhagavad Gita in terms of Satvika Ahara, Rajasika Ahara, and Tamasika Ahara. So that is the amount of importance that is being given to the food, wherein we need to stick on to the Satvika Ahara if we want to have a good resilience in the mind and also have a good strength in the body. So if you take Satvika Ahara, especially Bhagavad Gita tells that it is Snigdha, Sthira, and Hridya Ahara are Satvika in nature. So especially the food that promote the life, strength, happiness, satisfaction, which are juicy in nature. Oily here means Snigdha. Snigdha means using ghee in day-to-day food. And foods which are stable and pleasing to the heart are the one which increases the sattva. Whereas on contrary, if you see, this is what nowadays we are trying to use, especially Katu, Amla, Lavana, Ati Ushna, Tikshna, Ruksha, Vidahe. These are all taken to be as Rajasa Hahara, and it tells that Dukkha Shokamaya Pradaha. So he tells that these are Dukkha and Shokamaya Prada. So clearly it is Bhagavad Gita, it is explained. So if you see nowadays we are more prone to take too much of salty, sour, hot, pungent, dry. So these are the food, our lifestyle, fast food. So especially we try to eat fast food. So this is something bringing the changes in our body, especially in terms of the gut. So once the gut changes happen, we know that there is a close relation between the gut and the brain, and also you also know that whenever there is a disturbance in the gut, it influences our behavior also. So these are the certain things where it makes the person more prone for stress and anxiety. And similarly also, if you say tamasika ahara, so it tells that when we use tamasika ahara, especially the previous day food that is being kept, which has been slightly, which is not in a good state to eat, leftover remnants. When we eat, it tells that apicha amedhyam. He has told us it has to be as amedya. It basically it clouds our buddhi, that is intelligence, and our thinking capacity will be compromised. So because of which, like we see in anxiety that we will stick on to the same thing. Ati chintana, we will be going on like contemplating the same thought, which makes us more and more anxious. So hence, the food should be given more importance. As told, sattvic is the best diet, whereas Rajasic increases the restlessness and Tamasic causes dullness and lethargy. And if you see, I have tried to given some foods that I have tried to enlist it, like in grains, rice, wheat, oats, in milk and ghee. So especially this is very much important to have a calming and stabilizing, especially it enhances the ojas, that is the vital energy. Vegetables should be cooked, especially pumpkin. All gods are like bitter god, ash god, these are very much important. And also fruits like banana, apple, pomegranate. Pomegranate is one food that has been indicated in all the seasons. Spices, especially to aid our digestion, to preserve our gut, and herbal drinks like which contains brahmi or tulsi with warm milk like nutmeg and turmeric. So this safeguards our gut dysbiosis, and also brahmi and other things which these are adaptogenic in nature, which make us better prepared to handle the stress responses. And similarly, if you see in Vihara, following Dinacharya is very much important. Waking early in the morning, correcting our sleep wake cycle, going early to the bed, and waking up early. This especially helps to regulate the circadian rhythm, wherein minimum around 7 to 8 hours of good sleep is very much important. And the second is Abhyanga. So applying oil, so especially on the head, to the nose and feet. So you see, head is the about for all our senses. So and also the mind. So applying head. So we know that Vata is the one which controls the mind. Oil is the one which counteracts the over Vata activity. Hence, applying oil to the head is very much important. Nose is considered to be the gateway of head. Again, applying the oil to the nose is also very much important. And feet, you know that feet, when we do the feet massage, it relaxes the body, and also it helps to regulate the sleep. And when it comes to that of meditation and prayer, it's very much important. Yoga, meditation and pranayama are very much important. You know that yoga is the best partner along with Ayurveda for managing the stress, and especially yoga like Anulom Vilom, left nostril breathing, Brahmani pranayam. These are very much important. Meditation and pranayama So especially the mind and body based relaxation techniques are very much important. At the same time, avoiding overexertion, that ati vyayama. So vyayama is one thing that has been highlighted as a part of dinacharya, wherein work, that is balancing the work and rest, is very much important. So here vyayama is in terms of work also, that one has to take into consideration, and accordingly he has to like balance his work and the rest. So mainly Ayurveda, like it teaches us, just as medicine, discipline, lifestyle, rest, and harmony with nature is very much important for mind. And it is said that a calm daily lifestyle is the best antidote for stress and anxiety. And if you see for the Ayurveda therapies for stress and anxiety management, as I highlighted, Abhyanga is very much important. Why? Because it counteracts the Vata activity, it reduces the muscle tension, and it promotes the relaxation. Similarly, Shirodhara, wherein the medicated oil or the liquids are poured over the forehead, especially there are many studies which shows that it improves the parasympathetic activities, it improves the deep sleep wave cycle, and it induces deep relaxation and promotes the sleep and reduces the anxiety. And similarly, Nasya, as I told you, nose is the gateway. It clears the mind and relieves the stress. And Svedana, that is fomentation after the massage, it relaxes the body, reduces the stiffness, and it calms down the nerves. Similarly, Panchakarma, especially the periodic purification, we call it as Rutu Shodhana, that helps to balance the doshas in all the 6 seasons, and especially balances the Vata, and it is useful in chronic anxiety. And Padabhyanga, as I told you, it improves the sleep and grounds the mind. And lastly, the Rasayanas, especially we call it as Medhya Rasayana. So these are the certain herbs like Ashwagandha, Brahmi, Jatamamsi, Ishtimadu and all. So especially there are many studies which shows that they enhance the GABA activity, and also it improves the cognition, and it brings a sort of increases or enhances the resilience. So at an overall, if you see, Ayurveda mainly recommends the diet, the lifestyle changes, and then the therapies for mainly the management of stress. So in the last, I would like to like conclude my the talk through the shloka by Charaka, that is, as a person who knows how to safeguard his city, he will effectively safeguard. I mean, similarly, Ratasaiva Rati. So that is, as a person who rides the chariot, and he knows how well he need to control the horses and to ride the chariot very well. Similarly, a Medhavi, an intelligent person, one who knows how to safeguard his swasharira, his body, by restoring to all the principles that have been told in relation to the ahara, vihara, and the aushada. So this stress and anxiety can be very well managed. So with this, I would like to conclude my talk, and I thank for your patience listening. Thank you. Over to Aditi.
Thank you very much, sir, for that very insightful talk. It's very pertinent that we learn to understand the concepts behind the stress and learn to manage it. We thank you very much for providing us the valuable information and guidance in this webinar. We
Thank
move
you.
on to the panel discussion. So before moving on to the panel, I would like to introduce to you our leader of the panel, the one who will steward this panel forward, our associate professor of yoga, Dr. Hemant Bhargav. Sir, I would hand over the session to you, sir. Kindly take this the panel discussion.
Thank you very much, Aditi. My namaste to all of you. I am Dr. Hemant Bhargav. I am Associate Professor of Integrative Medicine in the Department of Integrative Medicine at NIMHANS. Basically, an MBBS doctor with MD and PhD in yoga therapy. As our head of the department, Professor Kishore Kumar, said, that this Department of Integrative Medicine follows the approach of rigorous scientific methodology to test the efficacy of traditional systems of Indian medicine in mental health and neurosciences. The whole objective of the panel discussion that we are going to do is based on evidence-based practices that can be utilized to lessen the mental health and the neurological disease burden, especially in India and worldwide. Now, I take this pleasure to introduce the panelists who are there with us today. First of all, I would like to introduce Dr. B.N. Gangadhar. Professor B.N. Gangadhar was the chairman of the National Medical Council of India. He also served as the director of NIMHANS and has more than 30 years of experience in psychiatry. He was senior professor of psychiatry at NIMHANS, and currently he serves as the professor emeritus in the Department of Integration. He is also the recipient of Sir C.V. Raman Award and Doctor's Day Award from the Government of Karnataka. We also have Dr. Madhava Diggavi with us. He is a professor of Ayurveda. He did his MD in Kaya Chikitsa from Gujarat Ayurveda University, and he is also an expert in managing Manas Roga from the Ayurveda perspective. He heads the postgraduate department in Kaya Chikitsa in Ayurvedic medicine and runs a 66-bed inpatient service and a CASA technology laboratory. He is known for his work in the area of Ayurveda, psoriasis, Ayurveda and immunity, and their integration. We also have Dr. S. Lakshmi Kandan with us. He is a professor of yoga in the Morarji Desai National Institute of Yoga. He holds a PhD in yoga after his bachelor's degree in physiotherapy and has more than 16 years of clinical experience in managing mental health disorders, especially addiction and several neurological conditions. He specializes in developing yoga therapy related program for mental health related issues and stress management. He has proudly represented India at the World Health Assembly Geneva as a part of Ayush delegation, and he's a regular resource person in national and international conferences that are organized in the field of yoga therapy. So, my dear friends, this is a very, very exciting gathering that we have got here, and I am looking forward for a very exciting, interesting discussion. Anjuji, can you unmute yourself, please? So, we are going to have a very wonderful discussion. First of all, I would like to talk to Professor B.N. Gangadhar. Professor B.N. Gangadhar has an extensive experience in the field of psychiatry. He was the one who started the yoga journey at Nimhans, and he is the one who pioneered starting first yoga center here at Nimhans. So first of all, BNG sir, can you hear me, sir?
Yeah, I can hear you.
Yes, sir. Sir, I would like to ask you a question. If a person shows some symptoms of depression, say initial symptoms are losing interest in the things in which person was previously interested in. Second, he starts feeling sad without any reason, develops crying spells. From the integrative medicine point of view, what would be your recommendation to such a person who is able to feel some depressive symptom within himself?
Yeah, thank you. Thank you for the comment. Thank you for the question as well. Depression has different levels of its severity. From whatever you described, it looks like either a mild or a moderate
Yes,
depression.
sir.
Typically, I would have recommended yoga for this. If a person is not suicidal, or if he is not severely disturbed, agitated, I would have gone ahead and recommended him to take yoga. Some of the yoga postures which have been standardized for this depression. I can also, of course, after the other panelists speak about, give you sufficient evidence, both biological and clinical, to demonstrate that depression gets better and bodily corrected following the practice of yoga.
So, sir, do you mean to say that the person can try yoga even before starting antidepressant medications?
Yeah, yeah. There is no hard and fast rule whether you should start or you should not start. The everything depends on how severe is any given symptom or a given disease itself.
If
So
there
if
are
the person
mild
is,
symptoms, sir, if the person is able
yeah,
to
so
manage
I
it
would
day-to-day activity.
definitely recommend yoga and let this person uh, recover with the help of yoga. And we have shown several studies which have demonstrated yoga being the sole treatment, being helpful, at least two or three done in our own institute. A case series have been recently published. And somewhere else in the world, people have also examined yoga as a monotherapy, a clinical trial. Both have indicated that yoga is effective as a first line of treatment in mild to moderate depression.
Okay, okay. And sir, when would you say that this person should not only do yoga but add medicine now? What are those warning signs?
Like I told you, if the depression is extremely severe, or the let's say I'll take up symptoms. Let's leave the depression being severe or more severe. Firstly, if the sleep has been very disturbed and the
Okay.
person, because of a severe loss of sleep, is not able to focus on things, it may be useful to add a small dose of benzodiazepine to help him to get sleep. The person is very agitated. Again, it is a part of anxiety and is going to make him more prepared for the purposes of yoga. And if the person is suicidal and very retarded, some of the clinicians would even prefer electroconvulsive therapy or start on antidepressant medicines. Last of all, it's very important, remember the patient's rights. The
Hmm.
patients may want, in spite of anything, to take medicines,
Yes.
particularly if they are seeing a very popular modern hospital, they will say, I want medicines.
Yes.
Or if they are seeing an Ayurveda person, Ayurveda yoga person, they would say, I would want yoga or Ayurveda. So this patient's rights have to be honored, and
Yes.
at the same time, your clinical judgment is also equally important.
Yes.
Although the patient may be in a situation like NIMHANS, where you are running the integrative medicine department, patient may not, may still want yoga, but it's our wisdom to look at the patient and advise whether it is good enough as yoga as a single treatment, or do you want to add a small dose. This is the richness of integrative medicine. It is not just this or that, it is this and
And
that. That
yes.
and has to be very judicious. It is there the entire success of integrative medicine is.
Thank you. Thank you so much, sir. In fact, clinically, I would like to share a brief, discussion on a case that came to us. This particular, lady had moderate depression. We started her on yoga, but she was so restless that she was not even able to focus on yoga and was continuously crying. But then, when we added medication, then she actually got into the shape to do yoga properly, and then she continued to adhere to yoga, and medication initially helped her to adhere to yoga. And then we observed that after regular practice of yoga for 6 months, under the guidance of a psychiatrist, the medication dosage were cut down by 50%, and in another 6 months they were further reduced and gently stopped, and she continued doing yoga. So thank you so much for that, sir. Now, natural question comes, what is it, that may help? There are so many yoga techniques, and of course, you should take guidance from a trained yoga therapist who is defined by having a master's degree in yoga from a clinical and academic institution. We have Dr. Lakshmi Kandan with us, who is a physiotherapist and has done PhD in yoga. Sir, we would like to ask you your opinion and experience about managing depression. And could you also guide us in your clinical experience? What kind of practices have helped such people?
Okay, sir. Okay. Namaste.
Namaste, sir.
Yes, sir. Sir, actually audible?
Yes, yes, clearly.
Okay. Okay. Sir, actually the depression It is in severe condition, it is difficult to manage only yoga. We need the medical management along with the yoga as a add-on therapy. So here, initially we can focus to not focus only on like a pranayam or meditation. We can just give some practice like asanas, just
Yes.
physical practices. So
Yes.
we can ask the person to perform like mild asanas, like a Tadasana, like a Tadasana, like that simple asanas. So the person focus on the movement along with the breathing. So automatically the mind can divert to the practice. So they were practicing asanas then along with breathing techniques. Like example, for example, if you want to do the Tadasana, so I want to raise the hand along with the breathing. So automatically the mind comes to the point. So when raise the hand along with the breathing, so automatically the person focus on the movement along with the breathing. So mind is come to this point. So automatically practicing like that asanas for more, a little more. Then we can go to pranayam. Then finally go for meditation, later stage. So initially we can recommend for practice, physical practices like asanas.
Yes, yes. Thank you so much. Thank you so much, Manikandanji, for sharing your clinical experience. And I think you have very correctly shared that in the beginning, the emphasis should be more on the physical practices. Aditi, can I share few slides? Just make me co-host. Here at Nimhans, we performed a MSc thesis where we divided the subjects into two groups. One group performed backward bending asanas, another group performed forward bending asanas. This was done in cases who had major depressive disorder. Just for the interest of the people who are there in the meeting, I will share a slide. And to engage people who are there in the meeting, also, I would like to ask a question and request your responses in the chat box. Which posture does a person adopt when he feels very sad? What do you think? If a person has a lot of sadness in his mind, what kind of body language would he adopt? This is something which I have learned from Professor BN Gangadhar. Would people unmute and share their views, or would they write in chat box? Hunched. Dr.
Bury their head
What?
into
They would
they
hide their head.
They'll bend
Yes.
they,
forward.
they
They'll
would
bend
like to
forward.
hide bury their head into their
Yeah. In fact, one thing I can
arms
say is
or
that they'll bend
chest.
forward.
They
They'll
will
bend
bend
forward.
forward. Jambunathji says they will bend forward. Is it
Yes, sir.
something like this, sir? Is it something like this? Can
A
everybody
little
see this
Yes.
slide?
more, doctor. A little
Even
more.
more. If the more the sad, the more the person would close himself. No?
Exactly, doctor.
So here, a person's mind is able to bring a change in his body language. He's closing his senses from the surrounding. He's not able to talk to anybody, and he's protecting his vital organs. In fact, this is the pose which a baby adopts in the womb of the mother, known as the fetal pose, because you feel very safe and secure. In lying down, this is known as Pavan Muktasana. In sitting, it becomes Shashankasana. And what do you think? Which kind of posture would a person adopt when he feels very happy? No? One who is very elated, happy with loved one. Say you go for a trek on a mountain and you feel very fresh and happy. Which posture would you adopt?
Just expand the hands.
Extended arms
Expand,
and
expand.
thrown back head.
Yes. So something like this. No? So this is the logic that I wanted to share, that chest opening, backward bending postures were found to be more effective, energizing. So if my mind makes me sad, can my body give a signal to my mind of happiness? So when I feel sad, I do hands in and out breathing. Breathe in, breathe out. Now my body is giving signal to my mind that I am in a happy state of mind. So I think Lakshmi Kandan sir was very apt, suggesting that the body should be targeted first, and then slowly the faster breathing practices, and then lastly the meditation, especially the longer meditation where they have to sit quiet doing nothing, eyes closed, like vipassana. Probably you want to avoid in depression, because people, they are already very inactive, and they are into their own rumination. So more asana, more pranayama, and chanting probably may help. Professor Gangadhar sir, any any suggestion on chantings and depression?
Yeah. We studied the effect of Om chanting at
Oh,
NIMHANS. Okay, this led to deactivation of some limbic structures, including anterior cingulum and amygdala and some hippocampus areas. Now, what I want you to note is these are the areas which actually generate emotions. And even in depression, a neurobiological substrate for depression is the hyperactivity in the amygdala and also in the anterior cingulum, also called as subgenual cingulum. This subgenual cingulum is a place where they actually put the deep brain stimulation electrodes so that this interrupts the excess signals that it is sending to other places. So, in other words, we have a biological substrate in the brain which is actually pushing depression forward, that is making it worse. And in healthy individuals, when Om is chanted, we found that this place in the brain actually is deactivated. So, which means chanting of Om loudly has two components, O and M. I generally recommend 1:2 part of it. And when that M is chanted, a person is expected to actually focus attention on the vibrations that he or she is getting around the scalp and including the throat area. What signals are picked up from these places, particularly in the posterior part of your head, in the behind the ears and in the temporal region. These signals are communicated to the brain through a nerve called as the posterior auricular branch of the vagus, both sides. Now, it is important, vagus sending signals to the brain happens from many parts of the body. It starts from your bladder upwards. But the vagus nerve stimulation has been used as a part of treatment of depression.
the
So
ear.
here we have the vagus nerve stimulation is stimulated by exposing the vagus on the left side, and you put a electrode into that vagus nerve and you stimulate one side. So even one side stimulation of the nerve directly is supposed to benefit depression, and also it is used for treatment of epilepsy either, which is not otherwise corrected. So the point here is exogenous stimulation of a vagus sending messages to the brain, vis-a-vis autogenous self stimulated vagus nerve by your chanting of Om. And looks like both produced similar effect of deactivating some of the limbic structures. And in fact, stimulate the ears electrically also has been demonstrated to produce transauricular stimulation, is also known to produce similar changes in the deep brain structures. So in other words, those who were acting more have now been cooled in a way, deactivated. And this would start a cycle which is going to cascade into a multiple levels. Maybe I'll stop here, which will biologically support remission in depression.
Sir,
Just as much as you said, the posture, depression is shown to have a posture which is low. So depression is also known to have some biological variables which are abnormal. Let's say if yoga corrects these biological abnormalities, in effect, the depression should get corrected. The moot argument is whether the depression caused these biological changes, whether the depression caused the posture is a different issue. But if I have any means of correcting it, would depression also get corrected? And we have shown that to happen. Thank you so much.
Sir, how many minutes of chanting in one sitting would you recommend for such effect?
Okay, everything depends on how well the person can apply his mind and train himself or herself. So this 1:2, I said, taking O and taking M, 1:2. And I also recommend both, that is, the chant of Om to be longer than the time taken to breathe in. So he has to take a deep breath. The deep breath is taken in, let's say, 1 unit of time, whatever may be the time. I'll come back later on. And the breath living out will be 2 units of that time. Let's say he takes 3 seconds to breathe in, and I'm going to ask him to take 6 seconds to breathe out. In these 6 seconds, like I said, 2 seconds he is going to spend on that O, and the 4 seconds starting. Okay, if you ask me whether traditional yogis recommend this, I'm not aware whether this is what they recommend. But I have used this as the model for getting these people to chant in the MRI box. So they take 20 seconds, in which they take 10 seconds, about 5 to 8 seconds for O, and then about 15 seconds for saying and then a little shorter, taking the entire breath inside. So
How
Om
many
chanting,
cycles, sir? How many cycles of
I
Om?
would want at least about 4 cycles every minute. It could be slower than that. The slower the better, which would give a longer time of the to be chanted. So people continue to practice 3, 4 cycles, 3 cycles, 2 cycles a minute. So the slower it is, the better. I generally recommend people to chant at least about 15 to 20 ohms in a given session.
Okay.
That would mean about 4 to 5 minutes. People have found that this short spell of training very motivating them to do it when a depressed individual or an anxiety individual is very stressed. So I tell them before breakfast, before lunch, before tea, and just before going to bed or before the dinner. These are the times when I recommend these people to practice it. There are, of course, different effects that have come up, which we have to investigate.
Yes, sir. Very interesting study that we did was seeing the effect of mobile phone radiations, because when we use mobile, those radiations are also absorbed by your brain, the EMF, RF EMF of the mobile. We expose teenagers for 30 minutes to mobile phone, and then we ask them to chant Om for 5 minutes. So what we observed was that Om was able to nullify and bring relaxation, which was the mobile phone was causing anxiety. So after 30 minutes of phone talk, it is, it would be good to chant Om for 5 minutes if you want your brain to relax. Thank you, sir. We also have Professor Madhava Diggavi with us, a renowned Ayurveda professor. Sir, in the clinical practices, we also see that when patients come to us, they say that I have been doing yoga, but can I also do some Ayurveda practices which are safe to overcome my depression and improve my quality of sleep? In your clinical experience, sir, what would you recommend to such a person? Kindly unmute, sir. Diggavi, sir.
Namaste.
Namaste, sir.
And thanking to the organizers. What I want to say is, really the yoga practice and the physical therapies of Ayurveda, Panchakarma, and also even modern medication, there is a need for integration. I started learning this concept of anxiety during our reproductive sexual medicine practice. When patient is given a calendar that on such and such date, the partner is having a ovulation, so you should have sexual intercourse. Then our male partner started getting anxiety. This is called performance anxiety. When we give a calendar date and time, they were unable to perform and they started getting anxiety and also depression. Then we started working on this aspect of anxiety in my field.
Yes.
Then this issue says that there is two phases of anxiety. One is excited or elated, another is decreased. So whether it is increase or decrease, both are explained in Ayurveda in the context of Unmada and Apasmara. One is hyper response and another is hyper response. So there is lot of human intelligence. Brain has got an intelligence to prepare for contracting with anxiety to prepare for contracting the depression.
Hmm.
You have very well demonstrated the posture
Yes,
when
sir.
it gets a depression or anxiety. What happens is in an adult male, he is supposed to get more sort of anxiety situations from day to night. Every day, everyone undergo anxiety levels and depression levels, but they come back to normalcy because of a special psychoneuroimmunoendocrine mechanism in the body. Every day, every child or every adult gets an anxiety phase and also depressive phase, but body has got a capacity to homostasis these imbalances.
Yes.
So that's why I go back to Charaka Samhita's concept of Kama Shoka Bhayad Vayuhu Prakopamapadyate Krodhat Pittam. These concepts of Charaka says that either any increased liking towards anything can cause anxiety.
Hmm.
That is, when a boy proposes to a girl, he is in anxiety state.
Yes.
He is having palpitation. His mouth becomes dried. He gets tremor. And when he first arangetram, anyone goes to a stage fear, is also a level of anxiety.
Yes.
Anybody goes to public address, there will be an anxiety. Vivavos, there is an anxiety. And the failure performance will also cause depression episode. So that's why Vata, Pitta, Kapha, all three are involved in the presentation of Chittodvega or Unmadapasmara or Bhaya, Shoka, Kama, all these manovikaras. So we need to tranquilize the body,
Yes.
mind will get released.
Yes.
We can relax the mind and we can relax the body. Actually, Ayurveda says first focus on body.
Hmm.
Whenever person is having any level of behavioral issues, anxiety, depression disorders, anxiety, depression syndromes, focus on body.
Even
Focus
Kannan
on
sir
the
said the same thing. First, focus on the body.
body.
Yes.
And focus on the body. And we treat such cases with only Panchakarma Abhyangam. We give
Massage,
whole
oil
body
massage.
massage. Whole body massage with certain oils.
Which oil, sir? Which oil would you recommend for anxiety and depression?
There is whole body massage can give relaxation, and whole the foot massage. Padabhyanga is talked in Ayurveda.
Hmm.
Proper foot abhyanga can also relax the anxiety levels, or only the shira abhyanga to the head,
Head massage.
abhyanga to the ear pinna can also get the relaxation. Karana Purana is told putting medicated oils to the ear, putting medicated oils to the head. That's why in our lifestyle changes, Ayurveda proclaims Shira Shravana Padeshu Tam Viseshena Shilayed. Every day, everyone should do oil application to the head and ears and to the foot, minimum. If not, whole body massage is possible. In case of clinical practice, we give Shirodhara as one of the Panchakarma procedure to anxiety levels and depression levels both, or any, if there is a syndrome, we give that. Then we observe that by the process of Shirodhara, there is alpha coherence in the brain's wave pattern. So
Hmm.
if you get alpha coherence by Shirodhara, Shirobasti, or Nasya Karma, Nasahi Shirasodwaram, the entire Gangadhar sir was rightly telling about the concept of yoga and Ayurveda is the left nostril breathing is Chandra, right nostril breathing is Surya. This
Yes.
is cold and this is hot, and center is Sushumna. So
Hmm.
the body has got 72,000 branches of nerves, left half of and right half of the body. In Shiva Sutras, it is more explained. And we have another concept that by giving nasal administrations also we can relax the body and in term mind, or we can give parectal administration of medication called Basti that
Hmm.
will change gut microbiota. Gut
Yes.
brain axis will be modified. So many, gut is having lot of endocrine secretions,
Yes.
and brain is also having lot of dopamine, serotonin, or catecholamines. These are cortisol levels. They are so many biological components. What Ayurveda says is when we do Panchakarma procedure, manaha prasadam apnoti. what is the benefit of detoxification, purification, or panchakarma shodhana procedures is by giving detoxification or virechana, vamana, basti, nasya, and uttara basti, then what we observe is manaha prasadam apnoti. The behavior of the patient will be completely becoming tranquilized. This is because the human brain is having capacity to release required neuroendocrines when there is a need or situation.
Yes.
So these are tailor-made releasing of the brain's chemicals to compensate the anxiety levels in the person or depression levels in the person. Both cases we studied with respect to psychosexual or reproductive endocrine mechanism. There we came to know that the
Yes.
happy hormones are there.
Diggavi sir, I would like to ask you a question here. You know, you said certain oils that you can put on the head or you can put few drops into your nostril or foot massage. For people who want to use it at home, which kind of oil would you recommend?
Very good question. What I see is if a Ayurvedic interventionist is working, they will select specific thailas, classically prepared and textually governed thailas will be explained. But still, safest way to practice these oils in home level is the sesame oil.
Sesame seed oil, til oil.
Sesame oil, I have done focused work on that. What we see is the sesame contains a rich source of calcium. It is having richest source of calcium, and calcium ions will work on human body's neurophysiology. When
Yes. Calming effect. Yes.
calcium is supplemented, psychoneuromuscular axis
Yes.
or hypothalamo-pituitary axis or thyroid. Actually, what is the main focus is thyroid plays as a interface between body and mind. Body and mind interface is very watertight compartment cannot be made. So these thyroid level hormones are shock absorbers. Whenever
Yes.
there is an anxiety, thyroid hormone responds to it. Whenever there is a depression, thyroid hormone responds to it. I have done a trial on serum lithium levels in anxiety and depression cases. We notice that all cases of anxiety and depression through thyroid axis, they have disturbance of serum lithium level. Lithium is a one of the periodic level
Stabilizer, mood
element.
stabilizer. Yeah.
It is very important element responsible for brain and the thyroid hormone axis. Whenever patients are having migraine attacks, anxiety attacks, depression attacks, lithium levels are disturbed. This sesame oil is one such component. If any homemade oil, that is cold compressed oil, not any other method, cold compressed oil of sesame oil has got a potent effect on vata dosha, body relaxation, anxiety and depression both. See, what is the defect is, if anxiety is more, patient will have weight loss. If depression is more, patient will have weight gain. Antidepressant will cause weight gain. Anti-anxiety drugs will cause the emaciation. In that scenario, one important aspect I prefer to tell to our community is this sesame. Second is cow's ghee. Panchagavya or cow's ghee alone Shuddha Gogruta, purest form of cow's ghee prepared in home without any bypass, without any adulteration. Purest form of cow's ghee has got a capacity to work on this network of psychoneuroimmunoendocrinal system, and it is having a power to give sufficient stimulation to the brain's nerve network. When we were working on Alzheimer's disease case, we studied this phenomena that the pure cow's ghee, and we have concept of the concept of Purana Grita, the old Grita. And we did a study on that. We take 10 kg of pure cow's ghee and watertight close it, and we dig into the 3 feet down paste. After 1 year, 3 years, 5 years, we take it out, and rancidity test was done after the 3 years of this ghee kept underground, and the rancidity test was passed. After that, we have used that Purana Grita either for Nasyam or for oral administration as a diet or for Uttarabasti. We found that significantly patient can tolerate the anxiety. What is important is we cannot run away from the anxiety, but we can make body so strong to face
Yes.
those anxiety
Yes.
ill effects.
Yes.
Anxiety ill effects or depression ill effects I quote Charaka Samhita. What it says is the Visha is responsible for causing these behavioral changes. Visha
Yes.
Sambhave. In Jwara Adhyaya, Acharya Charaka quotes that the toxins are either external toxins or internally released toxins or endotoxins or metabolic toxins. All these toxins will give trigger to the brain. That brain will be choked, and that's why anxiety is proposed as either palpitation, restlessness, sleeplessness. Dr. Umesh was rightly quoting, and Dr. Gangadhar sir was telling that symptom-based analysis of a patient. This
Yes.
is rightly we can make with use of either cow's ghee or sesame oil, and based on Charaka, the oldest physician says that what body impacts on mind, mind impacts on body.
The body. Yes.
These interchange phase under the influence of thyroid hormones and biological neurotransmitters are understood by Vaichityam, Aratihi, Glanihi, Santapo, Manasi, Manase. He
Hmm.
says that Vaichityam, Chitta is disturbed, Chitta is fulminant. Lord Shiva has got one symbolic presentation of Shirodhara. Lord
Shivadhana.
Shiva
Hmm.
is for Krodha, and to control that, Shirodhara makes alpha coherence by administration of Grutadhara, Tailadhara. We used only Murchita Tilatailam. Sesame oil is subjected to some manufacturing process, and application over the head or application over the ears or application through nose. Just put 2 drops of purest sesame oil to the nose. It will go and act through the Chandra Nadi and Surya Nadi and Sushumna Nadi as per Shiva Sutra. They make tranquilizing. Well,
Wonderful.
and another study on Ashwagandha Thailam.
Yeah.
Ashwagandha belongs to Somniferaceae family. So this Ashwagandha extracted oil, we tried in different administration techniques. It has got a lot of anti-anxiety level
Yes.
activities.
There
And
have been
based
studies
on
also. Yes.
the amygdala level or even at the limbic system level, Ashwagandha is having a powerful action to bring down the anxiety level or depression level. We were working on diabetes. Nowadays, we are seeing that diabetic patients are having a lot of anxiety.
Hmm.
When we send our patient to go to a blood test in the morning for fasting blood sugar, he will suffer with anxiety. And we tell them to give 2 hours after food, they will be having an anxiety that I am going for blood test, my sugar will be raised. Just like
Yes.
blood pressure, white collar blood pressure, when doctor or a nursing officer ties the blood pressure equipment, the BP rises. These
Yes.
are all due to the bar bodies. Carotid bodies and bar bodies are neuroreceptors. They suddenly discharge their chemical response to the brain, and this
Yes.
brain will develop anxiety presentations or depression presentations or one by one together. We call
Yes.
it as bipolar.
Kavi sir, I will just interrupt you here. I think you have given us immense amount of information, very very insightful. Uh, one thing which we I would like to tell all the audience here is that the Department of Integrative Medicine at NIMHANS is integrating these yoga, pranayama, and Ayurveda procedures along with antidepressant, ECT, and all the aspects of modern medicine, as BNG sir says, this and that, based on definitely patient also has his own choice and the mutual consent and discussion between the doctors every Monday, Thursday, Friday, 9 a.m. to 2 p.m. We have our OPD at Nimhans. You can come to Nimhans OPD block and ask for Department of Integrative Medicine. Visit in room number G13, ground floor room number 13, where a Ayurveda physician, a yoga physician, and a psychiatrist, they all the three physicians are going to see you together and have this kind of discussion what we are having here in the panel, where there is a psychiatrist, there is a yoga expert, there is a Ayurveda expert, and all of them are giving you inputs about managing depression and anxiety. As Diggavi sir said, that cow ghrutam, til tailam, sesame seed oil can reduce the autonomic arousal of the body and give you that strength to face the anxiety. One important point I would like to add is, especially in this rainy season, it is always better to make the oil or the ghee little warm. You can keep it in a bowl. That bowl should be kept in warm water. It should become sufficiently warm, comfortably warm before you put into your nostril or head. Uh, Thank you so much. This has been such an interesting discussion. We are coming towards the end of this panel discussion, but towards the end, I would like to give all the three experts 2 to 3 minutes to please share their own experiences in this field and give their message to the public who is listening to them. First, I would like to request Dr. Lakshmi Kandanji to share his views.
Yes, sir. Sir, actually, we always focusing mostly the quantity. How many times you want to do, how many rounds you want to do, so like that in yoga practices. So in my point of view, we want to focus the quality. So how to perform, that is very important.
Yes.
So our mind is while practicing the any yoga practices like asana, pranayama, whatever it is, we should practice with full involvement, then only we can get the result. It is not like exercise. We always focusing like rounds. I want to do 10 rounds. So mostly here the OPD, most of the patients come for like example back pain, knee pain, whatever it is. So they ask me like that, sir, in morning I'm doing these practices for half an hour. So this still there is no reply, there is no result. And they are doing that is they want to do the practice with a full-fledged involvement. That is, they want to focus with quality. That is, do the practice, maybe there is no need to go count the round. Just do the practice with slow and gently. And
Yes.
start told like that pranayam also like 1:2 ratio, 1:4, 3, 3:1, that is final range. So 1:2 is the normal range. So you want to do the practice maybe according to the patient capacity, maybe 2 seconds inhale and 4 seconds exhale, or 3 minutes 6. So like that, according to the capacity, they can perform everything. And the third point, in yoga practices, we want to make like start with the kriyas, then Shukshmayam, then Sulyam, Surya Namaskar, Asana, Pranayam, then Bang, Mudra, Dhyan, Yoga Nidra, everything. These are the whole packages. So you want to focus any problems, you want to focus all the list. So in that list, you want to choose which is best in the sequence. So first of all, before going to like any practices, you want to focus kriya, that is cleansing techniques. Then you will go for listening practices. Then you go for asanas like that. So the sequence should be very important. And another one,
Yes, sir.
uh, each uh, each practice, for example, if I do like a Brahmari pranayam, so
Yeah.
mostly the people, therapist says do practice Brahmari for 5 rounds. So the patient think just that means they are doing like mechanical. Here, the
Yeah.
very important is once the perform the practice like gently and slowly going to last minute to just go down slowly. Mm.
Hmm.
After that, we need few seconds gap. Few seconds we need
Silence.
some gap. So each practice we need few seconds gap. Then only
Yes.
we can get the result of that practice. So
Yes.
we are doing like mechanically like 3 rounds, 1, 2, 3, 4, not like that. This is my suggestion, my view. Thank
Yes,
you, thank you.
beautiful, beautiful. Lakshmi Kandanji emphasized the point that quality of yoga matters more than practice. The peace that you get after the practice is something that you have to hold on to and stretch it as long as you can, because the benefit of real yoga comes in the silence between the practices. Beautiful, beautiful point, Lakshmi Kandan sir. Let us hear from Professor B.N. Gangadhar sir. Yes.
Okay, thank you, Bhargav. I hope I am audible.
Yes,
Yeah,
sir.
the two, three quick points to when we are saying this and that, which you mentioned, I also mentioned. General question that I get be asked is, wouldn't it increase the cost of treatment? Let's say an Ayurveda person says you use this, and a psychiatrist says you use this, and then a yoga person says 3 times or 4 times you come here to do yoga. Wouldn't it burden the patient? This is a common question that I come
Sir.
across whenever I have spoken loudly about integrative medicine. The whole exercise of integrative medicine is jointly decide what is the minimum best that person should get. So it could, and also of course, honor the patient's choice. Patient would may want yoga, and he goes to an allopathic hospital where there's no yoga is not available. He has no choice except to accept the prescription that is given. So here we have a choice. The patient can choose. At the same time, we judiciously decide what is the least, but the most potent input that he can get, at least in terms of his burden, cost, the best in terms of he's getting out of the symptom. So this is very important. I want to emphasize that when we say this and that, that and zero, it could well be. So just that's the one message. Second message is a comment on Professor Digavi's thing. Antidepressants increasing weight. It happens, sir, because antidepressants produce improvement in their depression, and then their appetite increases and they start eating better. For example, most psychotropic drugs normalize their biological functions, and that would in turn cycle into. It's true that some antipsychotic drugs cause the increase in weight. Antidepressants per se increasing the weight is mostly due to the fact that they actually get this depression better, and the person eats most heartily and more heartily, and then puts on weight, which is true. I must also make a comment on in terms of motivating a person to take some of the treatments, particularly yoga. They very often, even in my earlier days, I used to see my colleagues who are yoga therapists, and even me would say that you should come for a month every day in a week and things such as that. Over time, we realized that even short practices, infrequent practices, also produce benefit. It is the uh, titrating that the patient himself or herself will do. I agree. I agree. Typical yogi sadhana involves a daily lifestyle change. Yoga is a lifestyle. That means lifestyle has to be run every day, which is true. But when it's prescribed as a medicine to a given patient, it is something that happens that adherence and compliance is not always the best with medicines for any treatment for that matter. This is something that I want to. It does not mean that we are going to. It does not mean that we say, okay, fewer is the better. It is not saying that, or we concede fewer in the intervention. Not even that. But it is known that even short practices of yoga for once a week or twice a week, thrice a week, also produce substantial improvement in patients with some of this condition, depression that you talked about in this meeting. Thank you so much.
Thank you, Professor B.N. Gangadhar. Professor B.N. Gangadhar, towards the end, the point that integrative medicine is not mixopathy where you are giving everything to everybody. It is a evidence-based, clinically informed decision making where a person may need only single treatment, a combination of two, or all the three based strictly on the scientific evidence. So that is the key message sir gave. Thank you so much, sir. Let us hear a message from Diggavi sir also. Sir, your message to the people here. Please unmute, sir, Diggavi sir.
Thank you, sir. Thank you, Gangadhar sir. And at an outset, I thank all the organizer for this wonderful opportunity and organizing such a meaningful public sector activity. I conclude Ayurveda is mother. It gives motherly care to the human beings. Dinacharya and Rutucharya are the chapters told in Ayurveda to be followed for prevention of anxiety, depression like activities in life. Third is Ayurveda is based on Pancha Mahabhuta theory. So live near to the nature. That is the message.
Yes.
Don't run away from the nature. Live as much as possible near to the nature and eat like your grandparents. Don't change suddenly your diet and lifestyle because our DNA will not accept all sudden exposures. So eat like your grandparents. Then lot of anxiety levels or such problems will reduce. And next is the school sensitization programs should be done in an integrated way so that if a child is taught before the age of 13 years, lifelong he will be having a strength to cope up with anxiety depression or prevention of anxiety depression. Once they become adolescent and adult, they will lose the temper of this lifestyle.
Yes.
Next is there is one Ayurvedic saying that Nityam hitahara vihara sevi samikshakari vishayeshu asaktaha data samaha satyaparaha kshamavan aptopasevi cha bhavatyarogaha. This is also told in Bhagavad Gita by Lord Krishna. Same word of Vagbata is told in Bhagavad Gita. This shloka should be taught to every young generation, IT/BT sector people who are working in stress levels. They should learn this. And sitting and eating, as per Ayurvedic conduct, is itself is yoga. Taking bath, taking daily lifestyle activities itself is a part of yoga. And another thing is samadosha samagnischa samadhatu malakriyaha prasanna atma indriya manaha swastha ityabhidiyate. We should teach our civilians prasanna atma, prasanna indriya and prasanna mana. ಕನ್ನಡದಲ್ಲಿ ಹೇಳೋದಾದ್ರೆ ಹಾಸಿಗೆ ಇದ್ದಷ್ಟು ಕಾಲು ಚಾಚು ಅನ್ನುವ ಗಾದೆ ಮಾತಿದೆ. We should be very happy with our life and we should be contemplated so that we'll not suffer with any anxiety, depression like disorders. With this integration in real sense is under one roof, giving all services for a expected customer. We are doing customer care. Customer should get what is his willing. Accordingly, we should make tailor-made, personalized solutions of lifestyle correction. And non-communicable diseases are threat to human society now. Rather than infection, trauma, and emergency, non-communicable diseases can be prevented by yoga and our Ayurvedic system of living style. And Ayurveda teaches how to bath, how to brush, how to sleep, how to wear clothes. Like this, nobody will teach you the life science. With taking advantage of this sort of integration, we can give healthy society to the nation, and nation building is by this integration. I am thankful for giving me an opportunity, and this integration should work out with taking some projects and working in the social sector, so that under the guidance of Dr. Gangadharan and NIMANS, like a pioneer institute working on these issues, a policy matter and policy makers should realize this scope of making lifestyle correction by yoga, Ayurveda, so that really the mental health activities and celebration of this meaningful mental health day is really working out with advancements in modern science and technology and ancient way of living style. Yoga accepted by all living being, because one who do yoga will realize the happiness, and if that happiness comes, the healing starts. Thank you, sir. Thank you for giving me an opportunity.
Thank you very much. Very insightful, Diggavi sir. I think your suggestions are really the words which the new generation has to follow if they want to really preserve their health, preserve their mind. Thank you very much. We have received some comment. Which chapter in Gita, Shloka? I think sir is talking about 2.14, Bhagavad Gita 2.14 that sir is talking about. Towards the end, I would like to thank all the wonderful panelists who were there with us. I would like to thank all the students who joined this meeting. I would like to thank the audience. Lot of elderly people, experienced people are there in the meeting here who shared their inputs, responded to our queries. I am so thankful to you. And as we leave, I would like to share some information with you for your further reading and yoga sessions that we offer. You can join. I will just share a few slides. For further reading, this is the book where we have published all our scientific literature and given our yoga modules for several neurological and mental health disorders. You can refer to that. And we suggest that integration should happen like a football team where you need the center forward to attack and defense to prevent the goal. So like that, the traditional and modern system have to come together. There should not be any conflict between them. They should work as a team. And we have been offering this tele yoga session in the morning for free since COVID times. And we have published this literature about these sessions, how they useful they have been. People who are interested can note down the Zoom meeting ID and the passcode below. From Monday to Friday, every day in the morning. Now it has shifted to 6:30 a.m. 6:30 a.m. You can log in and do yoga for stress management with us. You can take a photo of this slide. I once again take this opportunity to thank our HOD, Professor Kishore Kumar R. I thank our director, Dr. Pratima Murthy, and I thank all the mentors who have guided us in the whole journey of the formation of Department of Integrative Medicine, including Dr. D. Nagaraja, Dr. B. N. Gangadhar, and Dr. Shivrama Varamballi. Thank you very much. Namaste to all of you.